Greetings, everyone. Thank you so much for your participation on this advisory panel. We're really looking forward to our first meeting on Friday afternoon. Appreciate all the work you've put into getting prepared for this, especially those of you who were able to pre-record your introductions, which we'll get to in a second. By way of introduction, I'm Warren Smedley. I'm a vice president with the Kinetics Group. And like most of you, I'm a career healthcare administrator. Being late in my career, I've made the jump over onto the consulting side and been with TKG now full-time for about a year. My focus at TKG is healthcare operations and policy. I have a special emphasis on oncology and cancer center strategy, as well as bringing the voice of the customer to our pharmaceutical customers. Never stopped being a student and through my whole career. And I'm currently finishing up a Doctor of Science in Healthcare Leadership at the University of Alabama here in Birmingham. Currently working on my dissertation research on the adoption and diffusion of new cancer therapies. Let me jump into a quick 50,000-foot overview of our meeting and some of the logistics, and then we'll jump into your recorded introductions. So the objectives for our group. Why are we doing this? What's the purpose behind this particular panel and doing it over the course of a year each quarter? First thing we want to do is prioritize critical issues. We need your help prioritizing critical issues facing healthcare. These are the things that we as TKG need to be focused on helping our customers address. So we want your guidance helping us to prioritize the critical issues. There's a lot of noise out there. We need help prioritizing the critical issues and what we should be focusing on behalf of our customers. We want to be able to better advise our customers, so providing strategic direction from this particular group will help us zero in on how then to take these critical issues and advise our customers on how to address them or prepare for them. So you'll kind of help us to drill in on the critical issues, which will start this coming week. We also want to have your recommendations on how we should be investing in our capabilities. So providing guidance and recommendations on how TKG can be investing in our own capabilities to be better prepared for the future. Quick overview of the agenda, give you an idea of what we'll be talking about so you can be prepared. We've got 90 minutes together. We'll start out briefly with a welcome and meeting goals with JP Strapp, our managing director, and then go through the survey results quickly, which help to frame the structure for this particular meeting. Sarah and Neil will do that. Then we've got 3 focused discussions based on your prioritization through the survey. The first one is the growth of technology and what that impact has done on the cost of business and operations. One of our vice presidents at TKG, Mindy Oliveras, will facilitate that discussion. Then we'll jump into looking at how poorly insured populations are being handled by the hospitals. How are we dealing with these poorly insured populations? JP Strapp, our managing director, will facilitate that discussion. Then we'll be talking about how we establish system-wide clinical standardization and the importance of quality and process improvement. I'll be facilitating that particular discussion. We'll wrap up at the end with some takeaways and possibly some to-dos. Neil and I will do that with you and then talk about what we'll be doing looking towards our next meeting. What do we hope to be able to have as outputs from this particular meeting? The first thing we're going to do is issue a press release. So shortly after the meeting, we will summarize really highlighting what the purpose of the panel has been, what the topics were that were discussed, and we'll make sure that we let people know that we're actually doing this. We'll summarize the key findings. So we'll think of this as kind of a semi-white paper that we would summarize key findings from the meeting. We're going to provide that back to each of you. We want this particular working group to be helpful to you as individuals as well. So you'll get all the work product from the meetings that we have together. And finally, we'll do a quick follow-up survey with you to get your feedback, see how we did on the meeting, things that we might do better next time, or how we can shape future meetings. Quick logistics. The panel meeting will be recorded. That will help us with note taking. That's the only reason we're recording it, is so we can take notes and be thorough in capturing everybody's feedback. because we're recording it with video, we'll record the Zoom. We just want you to know that we are not going to use the video recordings without your permission. We don't frankly anticipate using them for anything other than note taking. But should we at some point want to have some aspect of this shared externally, we would have to get your permission before we do that. We may, however, probably will, reference your comments in our client work. So you'll be giving us direction. You'll be telling us what you think are the most important issues we should be focusing on and how we should be advising our customers and clients. We will rely on that, and we may reference what you say in the course of our work with our clients. Finally, to process the honoraria for you, we will need a W-9 from everyone. Be looking for that from me. I'll send it out. Those of you who have chosen to designate your honoraria to a charity, we need to make sure we have the name and address of that organization, which some of you have already done that, which is good, and appreciate that. But be looking for that message from me to get that started, that process started. We'll do it right after the meeting. Okay, let's jump into the introductions. And these are the introductions that we pre-recorded. Thank you.
I'm JP Strapp. I am the managing director of the Kinetics Group. I've been here for over 15 years now. Kinetics, as you probably have heard, really focuses and prioritizes the patient. And specifically, what we really try to do is utilize healthcare innovation and practice information to achieve the quadruple aim, which is a really great segue into the formation of this advisory board. We've spoken to Warren, and you're aware that the prioritization of the quadruple aim is of paramount importance right now, with there's so much disruption and change happening in the healthcare landscape. But what we try to do at Kinetics, and what we're hoping you can help us do, is to maintain focus on the patient experience, reducing the burden for the physicians and the care teams, bending the cost curve, and improving population health. That really is our guiding principle, is our alignment to the quadruple aim. And you as an advisory board could be instrumental to make sure that not only we maintain our focus on the quadruple aim as we move forward, but also help evolve some of our both strategies and tactics, specifically as we're looking at these integrated health systems and the various complexities that are associated with that. You have the dynamic of inpatient and outpatient. You have the dynamic of consolidation and trying to really address fragmentation and how best practices could be proliferated. So I'm really excited to have a chance to work and interact with you all in order for us to really continue to hit the mark with those guiding principles of Kinetics. From a personal standpoint, I have a master's in business, and I'm pursuing a doctorate in public health. So really my dissertation work, my academic work, is kind of related to my passion project, which is really looking to advance alternative payment as a vehicle to improve health equity. So I'm looking closely at the dynamic of health disparities and the barriers that exist to address them within healthcare systems, but I'm also looking at trying to align payment and outcomes via alternative payment models as a vehicle to improve that. So I look forward to interacting in that passion project. And clearly there is a connection between that activity and the achievement of the quadruple aim through this engagement. So I think it'll be a fun journey, and really excited to have the opportunity to work with you.
My name is Neil Pizer, and I'm working with Warren Smedley. In fact, it's a real privilege to be doing this, in facilitating this group of exceptional healthcare executives in these meetings, and look so forward to actually getting together with all of you. I know it'll be virtual, but that's great from my perspective, and that's what's working today. I have a master's in audiology from Northwestern University. I also have an MBA from Northwestern's Kellogg Graduate School of Management. And in terms of my work, I've done clinical work, I've done management work in healthcare. My entire career has been in healthcare, primarily in consulting in the areas of strategy and finance. And I'm real passionate about improving healthcare in the United States. I've been passionate about it for my entire career. And I've seen some progress. I'd like to see a lot more progress. You know, the US healthcare system provides some of the, I would say, the most advanced medicine in the world. And people with means from all over the world actually come here to access that extraordinary medical care. Yet there are three key issues that I see persist that we're starting to work on in a very positive way. And I'd like to see more movement there. One is, in the United States, for many individuals, and certainly for the society at large, it's simply too expensive. Healthcare is too costly for many. Secondly, I think while the US healthcare system offers some of the most exceptional clinical quality in the world, that quality is inconsistent. And we need to develop some consistency throughout the system. And the third area is that access is really inadequate for many. It's difficult for many to get to access this terrific healthcare system that we have. And this all needs to be fixed. And fortunately, I think we've seen some real advancements in the last few years, particularly around the push towards delivering value across the system. Secondly, I think in terms of recognizing social determinants of health and being able to address those issues. And lastly, but equally important, is a focus on empowering individuals in taking care of their own health care and getting them educated and getting them to learn how they could be part of their own solution. You know, it's a great time to be in healthcare, and I'm excited to be part of this panel.
Hello, my name is Mindy Oliveras, and I'm with the Kinetics Group. My role is Vice President of Innovation. And really what that means is translating the needs of our health systems, our payers, our employers, and our life sciences clients to help find solutions and opportunities and partnerships that are mutually beneficial and help everyone to achieve the quadruple aim. I've been in healthcare for about 25 years, including 11 years with an integrated health system with a health plan, oftentimes developing new concepts around healthcare transformation, medical behavioral integration, and payment reform. Most recently, in joining the Kinetics Group, I served as an advisor to quality impact, focusing on quality improvement, cost reduction, and patient engagement strategies to really drive care delivery transformation. In that role, I also researched and facilitated large physician-led groups focused on implementing behavioral health and substance use disorder best practices and integrative care models for providers throughout the Southeast. I also get to wear a hat on our life sciences side and work with them on improving market access, pull-through branding, and patient support programs. What I'm most passionate about is really about community advancement, along with education, elder care, and caring for those with mental health conditions and disabilities. Looking forward to meeting you all.
Hi, my name is Sarah Pugh. I am a senior director with the Kinetics Group, and I provide support for both the life science and care delivery teams within our organization. I'm a nurse by training, and I hold specialty certifications in both oncology and case management. And the majority of my clinical experience has been on the oncology field. I've also had the opportunity to support accountable care organizations, both primary and multi-specialty care, in their pursuit to succeed in value-based care arrangements. One thing that I'm personally passionate about helping in healthcare is using implementation science and improved communication to improve the delivery or the care that we deliver to our patients. Sometimes plans that look good on paper are not always tangible in the really busy clinic setting. And so my goal is to strive to develop solutions that support both patients and the care teams.
My name is Andrea Youngstrom. I am a vice president at the Kinetics Group, where I focus primarily on strategy development for payer and account management teams and development of programs for practice experience teams. In the latter role, we create practice optimization processes for incorporation of new therapies or technologies in medical practices. These programs address the needs of practice staff and their patients. Across all aspects of my work, I enjoy engaging with advisory groups such as this network, including occasional meeting facilitation. My background includes a master's degree in neuroscience and behavior and 25 plus years in the research, pharmaceutical, and biotech spaces. My experiences include academia, pharmaceuticals, and the consulting agency space. I've enjoyed the opportunity to be involved in a wide variety of therapeutic categories over the years. From a personal perspective, I'm passionate about equipping healthcare providers to provide the highest quality healthcare and engaging patients to take an active, educated role in their own healthcare journey.
Hello, my name is Armika Berkeley. I'm originally from Memphis, Tennessee. I am now in Northern California, specifically outside of Oakland. My background is largely serving as administrators in safety net hospitals and medical centers. So I've spent most of my career in the South, starting in Tennessee, working with, at the time, the largest faith-based FQHC or federally qualified health center, moving into a large health system in Tennessee, where I serve, really trying to help that health center get their population health work off the ground. And now moving from Tennessee to Birmingham, serving as their administrator or CEO of the medical center or indigent care facility there in Birmingham. And I'm now comfortably placed in Northern California as the regional leader at Kaiser for strategy and operations. What I'm most passionate about, I think, is really using the voice of the customer, specifically in very diverse communities, those communities with diverse cultures and backgrounds, as well as opportunities to access resources, really understanding how to use that to take kind of the current state of healthcare's cookie cutter approach to something that's really more what I call the Burger King way, right? How can we think about that consumer voice piece in a way that really actions or operationalizes health outcomes in a positive way based on who people are, their real lived experiences, backgrounds, and cultures. I think that's really our charge in healthcare. How do we think about how to do that? And that's kind of what I'm passionate about, and also what keeps me up at night, unfortunately. So very excited to join this panel. Looking forward to hearing these many diverse perspectives and learning from those in a way that we can move some work forward.
Hello, my name is Isabel Pacheco. My education and background is I earned a Bachelor and Master of Business Administration and Management from Phoenix University, and I am currently earning a doctorate in Healthcare Administration and Leadership from the University of Alabama at Birmingham. I'm a fellow of the American College of Healthcare Executives, an executive board member of the National Association of Latino Healthcare Executives, and I chair the Leadership Incubator for the National Association of Latino Healthcare Executives. I'm also an Apexis 340B certified expert. I've spent my 25-year career in the healthcare industry, specializing in hospital, clinic, and pharmacy operations. Over the last 15 years specifically, I've been assisting covered entities maintain a compliant 340B program. What I am particularly passionate about fixing in healthcare is the collaboration with pharma, 340B covered entities, the Health Resources and Services Administration, as well as the Biden administration to combat increasing drug prices and reaching a middle ground for 340B drug pricing program. I look forward to working in collaboration with all of you to help bring better solutions to our nation's healthcare industry.
Hello, my name is John Law, and I'm the Chief Strategy Officer at University Medical Center of El Paso. And from education background, I did my master's work in public administration at the University of Texas, El Paso, and I'm currently a doctoral student at the University of Alabama, Birmingham's program in healthcare administration. I work in El Paso, Texas. My hospital is about a half mile from the US-Mexico border, which is actually, as I look out the window right now, I'm looking at the border every single day. I'm really passionate about safety net hospitals and trying to figure out how we can have margin-based business that can help fund the uncompensated care that we need to provide. And I look forward to meeting all of you.
Hi, I'm Mike Blair. I'm the Chief Financial Officer at Central Care, We are an 8-hospital system in central Minnesota. We have revenues of roughly about $2 billion. And what I'm really passionate about is really 3 things. One is, how do we reduce the cost of healthcare? How do we expand access in innovative ways? And the last is rural healthcare. And how do we make sure that rural healthcare has the same quality and the same access as the metro areas?
Hi, my name is Steve Francavilla. I'm from the state of Wisconsin, where I was born and ended up staying here. I've been in healthcare about 40 years. I have a RN diploma, I have a BS in health arts, and I have an MBA. I have spent most of my career at Aurora Healthcare, which became Advocate Aurora Health, which is the 9th largest health system, integrated health system in the United States. I have a varied career, starting out as an ICU nurse, spending years managing also after that inpatient and outpatient areas. I spent about a quarter of my career in business development and marketing. I've also been a service line administrator of cardiovascular. I've been a administrator of a hospital for the largest tertiary center in the state of Wisconsin. In addition to that, I have also been somebody who's left the hospital side, and I've managed 2 physician groups over my years. My second one that I managed was a multi-state one. It was a single specialty cardiovascular group between Wisconsin and Illinois. I did that for a number of years as a chief operating officer. As I've gone through my career, again, I've worked in regions, I've worked in markets, and I've worked across the state. The one job that I had most recently, having retired at the end of last year, I was the president of Greater Milwaukee South for Advocate Aurora Health. That was the largest market within Advocate Aurora Health. It was located primarily in the city of Milwaukee. It contained 4 hospitals. It had a urban hospital, the last actually urban hospital left in the city of Milwaukee. It had a specialty hospital, which is a women's hospital. It had the largest tertiary center, Aurora St. Luke's Medical Center. And it had a community hospital with also an emphasis on psychiatric care and mental health care, with having a unit specifically designated to that. In addition to that, the medical group, which is the largest portion of Advocate Aurora within the state of Wisconsin and the state of Illinois, originated also from that area. Looking over again, things that are passionate for me. When you talk about the passion of healthcare, you talk about making a difference in somebody's life and making sure that you leave a lasting impression. I have hopefully spent my career trying to do that. When you talk about the passion of people that work for you, I'd like to have them see that same passion in me that I expect out of them. As people know that they work for me, I always used to say, if you're not here to make a difference, you're probably not in the right place when it comes to healthcare.
Hi, my name is Tim Maurice. I'm the Chief Financial Officer for University of California, Davis Health in Sacramento, California. I've been in healthcare finance since 1976 with my education at University of Washington in accounting and at Seattle University for my MBA. Been around the country. Here I am in California at the UC Davis, where I'm the CFO for a large health system serving all of Northern California, based here in Sacramento, where we're serving over 33 counties in Northern California. I've been here since 2011. I'm the Chief Financial Officer for the health system, including the medical center, ambulatory network, physician practice group, School of Medicine, and School of Nursing. So I'm both an academic and a clinical CFO for UC Davis. I've been, like I say, I've been in healthcare for over 40 years, been around the country in both large health systems, large medical groups, and here I am in academics where I started, and I hopefully will end my career. I'm passionate about improving value in healthcare. And where I feel that we can make the biggest impact in improving value in healthcare is, number one, providing universal access to those in need. The emergency room is not where people should receive their primary care. It should be only for emergencies, and it shows that we have a fragmented system if we don't solve the delivery of care by providing care where people live and preventing care as opposed to dealing with acute care. So that's my passion. Where I feel that we can make the most impact is in improving how we deliver care, making it more in the community, providing more digital care, reducing the cost of pharmaceuticals and having more effective use of pharmaceuticals, I'm on the board of 340B Health, which is a program I feel is very important to serve, to provide discounts to those safety net hospitals, including UC Davis, where we serve a large portion of underinsured and uninsured people. And that's my passion. So I'm glad to be here, glad to join this panel.
Hi, I'm Kathy Parnello. I'm the Chief Operating Officer and Executive Vice President at the University of Rochester Medical Center, Strong Memorial Hospital and Clinics. My background, I have a bachelor's and a master's in nursing and practiced in clinical nursing for a number of years, and then also have a PhD in administration. I've worked in clinical nursing both here at the University of Rochester Medical Center and at Rush University in Chicago for a brief period of time. I've been in central administration here at the university since 1995. And what I feel most passionate about is the work we are doing to reduce healthcare disparities in our community. Our goal is to make sure individuals in our community and our region have access to care, regardless of race, ethnicity, gender, socioeconomic status. It is so important to us. And I think this pandemic has highlighted the grave inequities that we have in our community. And I'm fortunate to be a leader in our organization that's working with a number of community groups to enhance access as well as service to individuals that historically have been underserved. The other thing I'm passionate about is creating and fulfilling the expectations of so many of our patients in public to have a single front door in which they can electronically connect with providers, their electronic medical record, can schedule and conduct virtual appointments, as well as schedule in-person appointments. I just think this is so important. There's so much technology available today, and I think we need to learn to use it better in serving our patients.
Hello, my name is David McGuire. I started out my career working in behavioral health and psychiatry in the administration of clinical programs, inpatient and community and so forth. And I did that for a good 20 years. And at the end of that part of my career, I was in the managed care area. Behavioral health was early on the managed care spotlight, and so I moved from doing that over into mainstream healthcare and went to work for the Mass General Brigham system, used to be Partners Healthcare, and spent the rest of my career with Mass General Brigham. I was in the managed care contracting department, and for many years I was the vice president for payer strategy and contracting. The last 2 or 3 years, just part-time in an advisory role. And we really treated that function as a part of the organization's strategy. So, the move to value-based care, the use of incentives to get our network to do things in quality that we wanted to do. We used contracts to incentivize the adoption of electronic medical records way back when and so forth. So we have tackled a whole range of strategic issues, including being looked at as having too high prices, including looking at the payer landscape as an issue in social inequity and structural racism, and the whole range of other issues. In the last couple of years, looking at innovations like telehealth, CAR T treatment for cancer, and other really high cost innovations. So that's been my career. Again, for the last 3 years, I've been part-time. And the things, that we have been struggling to improve, and that I would love to see, continued progress on, is the value equation. And if the top part is quality, the experience of care of patients, to me, is the biggest quality outlier that we do not nearly the job we should do on. And on the sort of the denominator, the cost side of things, or maybe it's the other way around, the numerator, but the cost side of things, we still treat, especially here in Boston, a lot of care is done in hospitals. A lot of it is done in academic medical centers. We have a couple of big ones, and that's a frontier where the incentives are just not aligned as a system yet, and I'd really like to see progress on that.
Thank you to everyone who pre-recorded your introduction. We appreciate that. Seemed to work really well. I particularly liked hearing everybody's passions, what they're passionate about addressing, solving, fixing in healthcare. We'll look forward to you bringing that expertise to the panel. There were two people who were unable to make a pre-recorded video, so I'm just going to highlight them quickly now. Two outstanding individuals. The first, Matt Malachowski, who's a PharmD, got his master's in health administration from UAB. We got to know each other through his work as the director of the specialty pharmacy at UAB here in Birmingham. He has since moved to Ochsner Health, and where he is now the system director of Pop Health and ambulatory care pharmacy. He runs pharmacy for the entire Ochsner Health network. Super, super bright guy. You really like him. Terrific individual. The other is Dr. Tim Atterbury. And Dr. Atterbury is currently the executive director for medical affairs at Analytics for Life. However, he's had lots of different roles. He was formerly a CEO at MedAxiom. Before that, CEO at the American College of Cardiology. Prior to that, president and CEO at Ballad Health System in Tennessee. And I got to know Tim through the Doctor of Science in Healthcare Leadership Program at UAB, where he is an alum and also an advisor. So we appreciate the two of you being part of our panel and look forward to meeting everyone together on Friday afternoon. So that will do it for this particular video. Thank you. We'll look forward to seeing you on Friday afternoon on Zoom.